Hi, I'm Dr. Vick from Elite Chiropractic. We're going to be going over shin splints today. A couple ways to help them feel better if they've started, a couple ways to prevent shin splints from occurring in the first place if they haven't started. One of the biggest things in preventing shin splints is training and how you progress your training. Making sure that your progressions are reasonable, that you're not going from no activity or a small amount of activity to a large amount of activity in a short amount of time will make a huge difference, allowing your bones to become more dense and ligaments and tendons to thicken, things like that will help prevent something like this. In addition to that, running on a softer surface will make a big difference for you as well. Instead of running on cement or asphalt or a treadmill, finding a trail or some gravel to run on will make a huge difference as well to lessen the impact. Those are the biggest things that cause shin splints. Treating them, we're going to use instrument-assisted soft tissue. We're using Rockblades in this specific instance. We're going to slide across the surface of the skin, find the areas that feel gristly or adhesed, and start to remodel that tissue and break it up and work through that. I'll have her go through a little bit of range of motion. Go ahead and bring your toes back to you and then tip them away. So we can work through a little bit more tissue there. We're working on the front side of the shin bone. This muscle is called your anterior tibialis. It can be a little tender as we work through because we are remodeling that tissue. We're not trying to cause any bruising or any redness specifically, but sometimes that tissue will develop its own blood supply. So as we remodel that, you may get a little bit of redness or bruising in there as a side effect. So that's something to look out for. We're not trying to create a bunch of inflammation in there, but you will get a little bit of localized inflammation as you're remodeling the tissue. So we'd scan through those areas, again, breaking up the adhesions, working through those layers, allowing them to glide and slide across each other more easily again. We want that muscle to reattach to the bone, which is what's causing the pain and the inflammation with shin splints, is the muscle separates from the bone a little bit and starts to create that pain, the shooting pain in the shins. So after we've treated that, we use a little bit of cryoderm to clean off the tissue, all the oils and everything off of there so the tape will stick. We're going to use RockTape. The first strip we're going to put parallel to the tissue so that gets lots of surface area there to help that muscle reattach to the bone. Then we're going to use a couple of cross strips to help pull and approximate that muscle back to the bone. So we've already cut our tape. We want to use the first 2 inches of that tape just as an anchor, so there'll be no stretch on that. We're going to put a little bit of the tape on the bone, a little bit on the muscle again, so that we're getting that sensory feedback and the mechanical advantage from the tape pulling that back to the bone itself. Then we're going to use a couple of strips just as an anchor to pull the muscle again back into the bone. If there's specific problem areas, points on the shin that are more painful, we can put the tape right over those as well. Working in an oblique pattern, pulling that muscle back up to the bone. That will help reduce pain as well as decrease inflammation there, moving that muscle back. I'm Dr. Vick with Elite Chiropractic.